Turning your Health Watch, it is PTSD Awareness Month, and across the country, 13 million people suffer from post-traumatic stress disorder in any given year. Joining us now is Dr. Charletta Dennis from Priority Health. Thank you for being here with us.
Thanks for having me.
So this is an important conversation to have with so many people suffering. Can you tell us about the numbers that we're seeing?
Yes, it's about 11% of women who experience PTSD and about 4% of men who experience PTSD. So in Michigan, those numbers can be as high as 200,000 people.
Okay, so when someone is dealing with this, what exactly does that look like?
It looks different in different people. Some people can experience symptoms like trouble sleeping, they can have trouble eating, some people can have hypervigilance, they have difficulties with loud sounds. People can also experience intrusive type symptoms. They can have nightmares, they can have difficulty just calming down. And depending upon how severe the symptoms are, they can impair functioning at work, functioning at school. So it really can look different in different people.
Now, is this something that you experience just for a moment in time, or is this a life change?
It's definitely a life change. Sometimes after a traumatic experience occurs, people can start to develop symptoms within days or even weeks. If those symptoms last longer than 6 months, then it can be diagnosed, but it has to be diagnosed by a medical professional.
What are some of the most common causes of PTSD? A lot of time we hear it's associated with people who've gone over to fight in the wars and things like that. But what are some of the main reasons and factors that people are dealing with PTSD?
Traumatic experiences that can threaten your bodily person, that can threaten your life, can cause symptoms of PTSD. So it's not just people who have gone to war, it's people who have been victims of personal violence, people who have been victim of sexual assaults, they can develop symptoms of PTSD. Also, sometimes people who hear about traumatic experiences over and over again, they can also start to develop these types of symptoms.
So let's talk treatment now. If you are dealing with this and you're trying to get better, what does that process look like?
For treatment, it can be a multiple different things. It can be either medication or psychotherapy or a combination of both. If the symptoms progress to the point where someone is having thoughts of suicide or they're hallucinating, then they may require inpatient hospitalization.
Okay, and if you are dealing with this, how do you know it's to the point that you need to speak with someone?
When symptoms become so severe that you're not doing the things that you used to, you're not functioning the way you used to, you're having trouble at work or you're having trouble at school, that's when it's time. So when your overall functioning becomes impaired, that's when it's time to seek help.
And in terms of seeing a doctor, you know, a lot of times a lot of people like to try to self-soothe or self-medicate, self-diagnose, getting on Google, trying to see what their symptoms are, but sometimes you need to go see a professional. How do you know the difference?
Well, first off, if you haven't been trained in diagnosing, then you should not attempt to diagnose. If you notice that someone is not eating well, not sleeping well, not behaving the way they used to, it's a great idea to tell them to seek professional help.
So it sounds like this isn't a death sentence. You can still live. There's ways to work around it. Is that the case?
That is. PTSD is a treatable illness, and you can improve your life only if you seek treatment.
And you really are speaking the positivity of treatment. That's a message that you're pushing. Why are you so adamant about that?
Because people need to view mental illness the same way they view other medical concerns. If you have high blood pressure and it doesn't get treated, you could have a bad outcome like a stroke. If you have things like depression, anxiety, PTSD, and it's not treated, the symptoms can get worse, and you have a least chance of getting back to your normal self if you don't receive treatment.
As we mentioned, this is PTSD Awareness Month. Any message for people who are suffering?
Absolutely. Seek assistance. If you're struggling with symptoms or you know someone that's struggling with symptoms, you can always reach out. You can go online to 988lifeline.org, or you can dial 988, which is a crisis lifeline. At Priority Health, we have our behavioral health team available 24 hours a day, 7 days a week for confidential help.
All right, Dr. Dennis here with Priority Health. Thank you so much for joining us. Important conversation. We appreciate it.
Thanks for having me.